So a couple nights ago, Bernie Sanders did a town hall with Chris Hayes. This is the second one they've done. They did one earlier since Trump's been elected in December, and that one was in Wisconsin. And so this one was in a small county in West Virginia. It was called McDowell County. So this county is considered the poorest county in West Virginia, and it's a sort of historical county because back in the 1960s when John F. Kennedy was running for president, he promised that he would help the county if he was elected. And so once he got elected, his first executive order created the food stamp program, and this county in West Virginia was the first recipient of the food stamps. And so this town hall starts off talking to a coal worker. So the way this town hall was set up is like Bernie's just sitting in the middle of two other people on each side of him, and then they would alternate talking to the people, and then sometimes they would go to the crowd and talk to other people who had questions for him. So first it starts out with this coal miner talking, and then so the topic brings up that coal has obviously been declining since the country's trying to switch over to renewable energy. And so Bernie says that we need to transform our energy while not leaving the coal miners behind, which pretty much everyone agrees with that. And the only problem with this, I feel like, that it's like you say, it's like we need to switch to alternative renewable energy, obviously, but it's not really as simple as I guess he makes it out to be. You need to have a detailed plan as to how exactly we would be able to switch to energy and keep all the jobs that coal miners have for the new energy. And then so this coal miner isn't really that smart. He says that nuclear is way worse than coal, which is not true. But I mean, nuclear is dangerous, but if something like what happened in Chernobyl happens, like a massive nuclear like explosion, obviously it releases a ton of radiation, and it's just like uninhabitable for a long time. And then so this coal miner then says that trees take in carbon, which he's saying that's a good thing, but the problem is that, which most people know this, is that the amount of carbon we're releasing is like by just way too much than that the trees and plants can take in, which is why we have the problem of climate change, is because there's too much carbon. That's part of it. And so Bernie is being pretty sympathetic to the miners. He's saying that he wants to keep their jobs, and then he goes on to say that the miners have contracted lots of deadly diseases and that we owe them a great deal. And then so the topic changes to healthcare because obviously the new Republican healthcare plan was just released about a week ago. This woman comes on, she works at an OB/GYN, and so she says that 8 years ago, a quarter of her patients used to be on Medicaid, and now that number is up to about 75%. So a lot more people need medical coverage. And then so Chris Hayes asks people to raise their hand if they are on or know somebody else who's on Medicaid, and so most of them raise their hand, which isn't that surprising. And then so Bernie later says that there have been a lot of people that will go to the doctor, that will not go to the doctor when they're sick because they don't have insurance and they don't have the money to do that. And if they go to the doctor, then they have the chance of just like going bankrupt because they don't have any insurance. So this next video I'm gonna show you is just Bernie talking about the healthcare plan.
But what really bothers me is that when you look at the Republican bill, it should not be seen as a healthcare bill, because throwing millions of people off of healthcare is not healthcare legislation. What it should be seen as is a huge tax break for the wealthiest people in this country. 200 at a time when we have a massive level of income and wealth inequality, where the rich are getting much richer while the middle class shrinks. This legislation would provide, over a 10-year period, $275 billion in tax breaks to the top 2%. So when people tell you, oh, we don't have enough money to invest in McDowell County or rebuild our infrastructure nationally, but we do have $275 billion to give to the top 2% who are already doing phenomenally well, when they tell you they don't have the money, don't believe them.
So I really like this quote from Bernie. So he's saying that this healthcare plan doesn't really help anybody. It's just a big tax break for the rich, and that that last part was the best part. He was saying that that when they say that we don't have the money to invest in infrastructure, don't believe them, because they have plenty of money that they can afford to give billions of dollars in tax breaks to the rich. And then so he was saying that lots of people are going to be thrown off the healthcare. And so a new CBO report, which is the Congressional Budget Office, so they say that if this Republican healthcare plan is passed, in the next 10 years, 24 million fewer people are going to be insured. And so that's a pretty big number. So next, a new woman comes on with a pretty sad story about her son. So she says that her son had to have a liver transplant, and they incurred about $800,000 in bills, in medical bills. So in the insurance she had, she didn't know this at first, but then like apparently in the fine print they said that the insurance had a $1 million lifetime maximum amount that they would pay out. And so the only way her son was able to stay on healthcare is because the Affordable Care Act allowed her son to stay on her parents' insurance, on his parents' insurance. So and then now she is saying that her son has acquired a new disease where he's unable to speak and has to have a feeding tube. So it's a pretty sad story, which is like saying that we can't, like, there's going to be a lot of people that suffer very greatly from if this new bill is passed. So next, an older woman comes on, and she was saying was saying how she knew a lot of people who worked in the coal mines, and a lot of them had got black lung disease from the working in the coal mines. And so she brings up that Nixon wanted coal miners to be compensated for damages to their bodies from working in the mines. And then when Reagan went into office, he made it hard for miners to prove that they even had black lung, which is pretty bad. So then she says that when passing the Affordable Care Act, they signed a provision that made the companies prove that the miner didn't have black lung, rather than the miner having to prove that he did have black lung. So it made it easier for them to get care for working in the mines, which is obviously a very dangerous job. And so and then, which is another big thing, so they say that if the new Republican plan is signed, then this rule, then it'll go back to before this rule was in place, so that the black lung rule from the Affordable Care Act will no longer be in place. Okay, so the next video is Chris Hayes talking about how rural areas will be impacted greatly from if the new Republican healthcare plan is signed.
Senator, I gotta note an irony about this bill that's in Washington that Judy brings up. If you look at this bill that's being proposed in Congress right now, whether you support it or oppose it, one thing you notice is the people that take it on the chin the most are rural folks. That's just a fact about the way the bill's structured. You could think the bill's great or you could think it's terrible. But if you look at the subsidies, if you look at the black lung provisions, I mean,
Rural hospitals will be devastated.
Rural hospitals, I mean, this bill, whether you think it's great or not, whether you think the Affordable Care Act is to go and you want, quote, more choice, it does seem inevitable that rural hospitals, rural healthcare delivery, and rural folks are going to take it on the chin the most of this bill.
So the irony is, I think you're suggesting, is that many of the folks who voted for Trump are going to be hurt the most.
So this was a pretty big moment from the show. So Chris Hayes is saying that the rural areas are going to be impacted pretty greatly from the if the new plan is signed, because a lot of them need healthcare to survive, and if the new plan is passed, then they won't have healthcare. And so Bernie's like, it's ironic because a lot of them voted for Trump, so they basically voted against their own interests. They thought that everything was going to be great, but now if the new plan is signed, they're going to lose healthcare. And so later Bernie says that there's a reason why the American Medical Association, American Hospital Association, AARP, and some other medical organizations oppose this legislation, and it's because it's going to take a lot of people off healthcare, and it's just a bad plan for healthcare. And then so Bernie says that Obamacare right now is not perfect, and pretty much everyone agrees with that. And he's like, premiums and deductibles have gone up, which is true. And so later, the next big thing from this town hall is the topic of is the opioid problem, which a lot of towns like this are having. So Chris Hayes talks to a state senator involved in a lawsuit against drug companies, and that's what the next video is about.
Mr. Chafin, stand up for me for a second. You served in the state senate for 32 years.
I did.
You're part of a lawsuit right now against the drug companies. We covered this on my show last week about drug wholesalers. What's the lawsuit getting at?
The lawsuit is, we're ground zero, Chris, as you know, for opioid drugs in the nation. McDowell County, the city of Welch, a little city west of here named Kermit, they dumped over 4,194,000 pills in that little town with 400 people. Say
that again. Say that again.
A little town of Kermit, most people know west of here.
It's got 400.
In 2015, it has 400 people. 3 companies dumped 4,194,000 opioid pills in it in 1 year. The pharmacy there was making $500,000 a month selling these pills. People had 10,000 pills in their pocket, and they were selling to anybody that wants to buy it. That is Amerisource Bergen, McKesson Corporation out of San Francisco, and Cardinal Health out of Ohio. So this suit is bringing, we brought the first political subdivision suit in McDowell County that's ever been brought. Our legal team did. We also just recently filed a suit for the city of Welch. And it's for the opioid epidemic.
And you're saying that you irresponsibly pumped these pills into this
Absolutely.
county.
They knew it was intentional, it was willful, it was wanton. If you were making a deadly, highly addictive, poisonous pill, And if you take it in any quantities at all, and you send 4,194,000 to a town with 400 people, what do you think these companies are thinking? It's all about money.
So the state senator is talking about how this county is involved in, it has a pretty big opioid problem with doctors overprescribing these pills to people. And so he says that 3 companies dumped over 4 million pills to this town called Kermit, and which only has 400 people in it. So they're overprescribing these pills, and so if that many pills were prescribed to these 400 people, then that would mean that each person would be taking 28 pills per day, which is obviously people don't take that many pills. So they go on to say that the opioid pills are just being, the extra pills are being just sold off to the rest of the people elsewhere, and which causes the big problem, because you can't get the pills without a prescription, so they sell it on basically like the black market. They deal it out to people to make money off of that. And so the next video is about this 29-year-old woman who is also talking about the opioid problem.
Dina, you grew up here, right? Can you talk a little bit about what it's meant to watch this happen around you here in McDowell?
A lot of the people that are my age are not here. They're in cemeteries, they're buried. They've left children, they've left moms, they've left dads. It's sad because, like the gentleman said, you know, there's nothing to do here but it seems like get high. And it's sad because our generation, that's all we have to look forward to around here. And you know, I have 2 children of my own and the 3rd one on the way. And if there can be anything to be done about this, I want it to be done, you know, because they don't have a voice, and I do. So, and I agree with Dr. Tucker. A lot of the doctors here do over-prescribe. I myself am on 13 different medications alone at 29 years old.
So that woman, she said she's only 29 years old, and she's talking about how she knows a lot of people that have died from the opioid problem. And so she saying how the town is just like pretty depressing, and saying that there's nothing to do here but get high, and that's what our generation is all they look forward to. And yeah, so she says that doctors are overprescribing these pills, and she's already on 13 different medications right now, and she's only 29 years old. And so the next video, this state delegate is talking about still the drug problem, and is saying how it could possibly be fixed.
I'm concerned, you know, that we have so many people here. As a teacher in this school for 35 years, it bothered me that so many of these kids said the first thing they wanted to do was get out of here, you know, because there was nothing for them to do, as she said, except for the drugs. We put a federal prison in here, and one of the deals with the federal prison was that so many people in McDowell County would get a job. The problem was we couldn't get people to work because they couldn't pass the drug test. Right. So now they bring them in on buses here. Mm-hmm. Yep. They literally
so even
provide...
when you bring jobs, right, which everyone's saying this place needs jobs, people that live here can't get those jobs because they can't clear that drug test.
That's correct.
That's right.
And it concerns me that in the legislature, all we're doing is passing bills that will put people in jail longer for doing the drugs. You know, we're not doing anything on the front end. We're not doing any education. We're not doing any treatment. We need a treatment facility here worse than anywhere in America.
So I agree with this, what this state delegate is saying. So he's saying that these school kids want to get out of town because it's so bad with all the drugs coming in, and he said that people can't get jobs because they can't pass the drug test. And then the biggest thing I think, which I agree with, is he saying that we're putting more like punishments on people who do these drugs, which doesn't really help the problem. It's just like it's just giving harsher punishments to people who get caught with these drugs. And then so Chris Hayes later asked for the people in the crowd if they know someone who they have lost due to opioids, and quite a few of them raised their hands, which is pretty bad. And then so Bernie says that harsher punishments are not going to help, and that so the big thing that I agree with from the state delegate is he's like, we need a treatment center to be built to help this problem, which I think would help it pretty greatly. Helping people cure them from their addiction rather than punishing them for it is the way to go, I think. So the next video is about the coal miner from the very beginning. He goes on to talk about healthcare again.
Bill, let me ask you the same question. You're back in the mine, so I think you're probably feeling good personally about where things are headed. Mm-hmm. How much have you been paying attention to what's going on in Washington this president? How much do you feel encouraged by the direction things are going?
I've paid quite a bit of attention to it all, really. There's a lot of protesting, like Mr. Evans said. And I don't really know a lot about politics, and I don't know what Donald Trump's going to do for the rest of the country. But as far as West Virginia, that's what he promised us. You know, that's what matters to me. Because I'm a West Virginian. I'm proud to be a West Virginian. And I voted for him only solely because he said he was going to help us. He was going to put the coal miners back to work, and we're going to have health care and this and that. We need health care. Everybody in this room needs free health care.
Mm-hmm.
This is pretty crazy that this coal miner, who is a Trump supporter, and so he says that he's not that into politics, but he says that everyone in this room should be able to have free healthcare. So the crazy part is just like he's arguing for universal healthcare, which is something that Bernie offered whenever he ran for president, and Trump sort of said it, but obviously now he's not. You can, from the legislation he supports, he definitely does not want universal free healthcare for all. And so it's just crazy that this coal miner, along with a lot of other Trump supporters, agree that everyone should have free healthcare, but yet they still support Trump, even though with a major policy decision, they're voting against their own interest with the policy of healthcare. And then so Bernie, wrapping up the town hall, he's saying that healthcare should be a right and that we need to invest in infrastructure and education to create jobs. And then he says that he wants all the kids in the country to be able to know that if they work hard and study, that they'll be able to go to a good college tuition free. And then so he says that we are the wealthiest nation and we don't need to give tax breaks to rich, and we need to invest in the working people. So overall, I thought this was a pretty great town hall. There's a lot of ideas mentioned. It's very substantive, and I wish that Bernie would have been able to talk more. I like that there's a lot of different people that were able to share their ideas though too. And so it's good that they're having Bernie on TV for shows like this, and I think they should have town halls like this more often.
Target.